We're here today with Sara Meinke of Baptist Health Jacksonville. She's a Senior Director in Enterprise IT Ambulatory Network and Innovation at Baptist Health Jacksonville. For our listeners, Baptist Health is a health system based in Jacksonville, Florida that operates 7 hospitals and 200 ambulatory clinics. The system has 1,100 beds, 2,400 providers, and 15,000 employees. Sara, thank you so much for joining us today.
Thank you for having me. I certainly appreciate it, Jordan.
Sure. So we're going to cover 2 main topics today. One is going to be the Patient Voice Collaborative, where Baptist Health Jacksonville has been seeking patient input into driving IT initiatives. And then we're going to be discussing business systems transformation. So just to get started here in the Patient Voice Collaborative, I understand you've partnered with KLAS recently and you've surveyed patients on technology perceptions and the utility of technology. I'd love to hear some of the lessons learned, some of your objectives, what kind of led to that initiative, and I think our listeners will be really interested in kind of how that has impacted your execution of your IT strategy at Baptist Health Jacksonville.
Yeah, absolutely. So we were approached by KLAS, one of 5 organizations that were selected to partner, or at least offered to partner and develop a development of an inaugural survey for the patient voice. So, long time, we've gotten feedback related to encounter-based care, other different survey mechanisms to, essentially define what our Net Promoter Score is. But we've had little insight into how patients perceive the technologies that we're deploying across our organization. Sometimes, you think you're doing the best for your patients. So with respect to, hey, we're going to deploy this new app, or, you're going to have the ability to see your physician online. And we think that it's going to be something that's highly desirable. And this right here has given us a little bit of that deeper insight that led us to go, are we really meeting the patients where they need to be met? Are we providing them with the tools that are necessary with what they perceive as their best way to engage their clinician? So this definitely allowed us the opportunity to dig into some of those insights based off of, of course, our N was small. It's the first survey, so it's really establishing our baseline here. But it certainly, I think, opened up the curtain a little bit behind what our patients are thinking and feeling and how they want to participate in their care from a technology perspective.
So when we're talking about the survey, I think some of our listeners may be interested in learning who created the survey, how was it implemented, who's responsible for implementing it, and then what was the fiscal note attached to that survey? Did there have to be a budget allocated? Which departments kind of had to check off on what topics would be included? How did that whole process
So I can start with the easy one. So fortunately, from a fiscal perspective, since this was inaugural, we got to participate for free. Not to say that that would be something that other organizations might have a dollar or price tag associated to at some point in the future if this does really gain the traction that we think it's going to. But KLAS, the Patient Voice Collaborative segment in particular, helped to orchestrate I would say a collection of things from the 5 different organizations that help to inform and structure their survey. So we actually had the unique opportunity to draft out questions and put that together as a cohort.
So were these other organizations from across the United States?
They were, yeah. So, from Kansas to California to Florida, we had the broad spectrum of, I think, the country represented in geographic areas, which I think was telling with some of our, survey results when we compared our organizations. We had the social sentiments, here in Florida. I touched on some of the, hey, we think we're deploying the right technology solutions, but it was very informing that our patients don't necessarily want to engage with their providers by way of a digital modicum.
Mm-hmm. I'm interested in the findings, but before we get to the findings, I'm interested, since we're on the creation of the survey, kind of could you give us a taste of some of the flavor of the questions, and did you find any variance in the objectives of the 4 other organizations?
So, for example, there was a California-based organization, and what they were doing was very transactional in nature. Like, I want to get in, I want to get out, I want the fastest way to see my provider. Whereas, with our patients in particular, they said, absolutely not. We want to see our patients, our providers in person versus that very transactional, relationship. Here in the South, I suppose, and I've been here my entire life, we're a bit more, soft and I would say desire that soft touch from our physicians, and having that face-to-face time is, significantly important.
Interesting. So there are regional differences in kind of the responses. So I think what you mentioned earlier that you wanted to learn from patients and consumers to align to meet their needs with your technology stack, I suppose. And you're interested in creating a more human-centered design and to learn what patient perceptions were. You've previously had patient-reported health outcome surveys. You've had HEDIS scores, but never have you previously gotten patients' insights on what they want from their technology. So what were some of the key findings? It sounds like you have some regional disparities with whether they have a preference for meeting in person versus just having a quick transactional encounter with their provider. What were some of the other findings that you found from this survey?
So, what we found as far as our patients, there was, obviously the desire to communicate and meet with your provider in person. We also found that the desire for increased flexibility around managing their own care was highly desired. Interestingly enough, there was a shared sentiment amongst all the organizations, and I think this is a struggle that many of your listeners can relate to, is self-scheduling. So, finding that sweet spot of being able to do that on-demand care versus I'm going to pick up the phone, call the provider, hopefully get in to be seen within the next couple of months versus when I need it at, that point in time. So that was definitely a shared sentiment. Additionally, another, interesting thing was patients that did not see themselves technologically savvy, I guess, per se, is that they felt that organizations were essentially shoving the technology, to them without getting, their input on, hey, this makes sense. I mean, we have so much opportunity organizationally to tap into, patient experience councils and really have them serve as that incubator, even with our employees, right? Our employees, our patients, we have this built-in incubation tank that we can, trial these things out prior to deploying to the broader public.
So you mentioned there's a number of different responses. It seems like it varied across different organizations, but patients generally wanted more communication with physicians, more appointment flexibility. I'm wondering how these survey responses have affected Baptist Health Jacksonville's IT strategy and vision.
Absolutely. So it's actually a great question. And it's something that, one of the key things after we concluded the survey, we evaluated the responses and have backed it into our strategic pillars. So making sure that we're carving out those core nuggets that we can, make a market difference in, how we're deploying our technology solutions into the patient populations that we serve, but also ensuring that it aligns with our organizational strategy.
Right. I'd like to pivot now to the other topic that we were going to discuss today. On the topic with organizational strategy, I'd like to talk about business systems transformation, in particular, enterprise resource platforms and workforce management. I know that you have two initiatives right now. And it's not even necessarily being led by IT, but IT is critical to both ERP and WFM. And I'd like to know kind of some of the integration challenges, kind of what your current state is, what your desired future state is, and how you're going to get there.
All right. Well, this is always a fun-filled diagram. So I'm going to This is going to be part of our why. You know,
Okay.
with ERP and WFM in particular, and by the way, we're just off the heels of our Epic implementation. So we went live back in August of 2022 and had this, you know, Cadillac of an EHR platform. And, you know, this is what we have in our business space today. So just really quickly, I'm going to flash this up. As you can see, this is a very complex transactionary environment that is not going to be nimble or flexible enough for what we need with the growth trajectory that Baptist Health is on. So when I think about, you know, this is just one application. All of these lines, and everybody knows our HL7s, our SFTPs. Again, I go back to very transactionary business models, and we need to be able to flip that script and have solutions that are going to match nicely to our EHR and complement it, where we can make informed business decisions while on the end stream provide cost-effective and quality care.
Let me pause for a second. For our listeners who are listening to this podcast and are not viewing the video, right now Sara is sharing a slide of an application profile for PeopleSoft, and it has three concentric circles with PeopleSoft in the middle, and then it has about 50 smaller circles with different arrows in the periphery, all pointing into PeopleSoft. So, Sara, so your current state, you said you have this Epic implementation, you have a lot of high growth trajectory. I guess there's M&A activity, there's expanding your market share. Your current state, you have bifurcated systems, you lack integration, access to robust analytics that drive data-driven decisions, and you're looking to unify your platforms, maybe moving to new vendors. But I'm interested, kind of, how are you going to get from here to there?
Well, that's the perfect segue. So without, you know, any initial investment in really rethinking your current state, you have to take that deep dive analysis and understand how the operations or your business processes are running today. So we have invested a significant amount of time over the course of this past, I would say, 10 months, just looking at policy and procedures, understanding what our pay practices are, and really doing some partnered work with operations. Let me get to the next one. So this is another lovely depiction of some of the pre-work that has to be done in order to really put in a system and solution that is going to make a difference in the way we're doing business overall. Healthcare, you know, of course, you know, we're in it for the patient, but you also have to have the financial and business mindset that, you know, you have to, you know, meet your margins as well, just as any other for-profit business would.
So would you mind describing the slide that you're presenting to us?
Yep.
And kind of your pathway forward to unify the different platforms, either through Workday, through UKG Pro, and how you're reconciling the business end of running Baptist Health Jacksonville with providing care to patients?
Absolutely. So for folks that are not seeing the visual, as you know, there's a common theme from time to time that folks reflect an iceberg, and this certainly is an iceberg, and IT is just a small part of that equation. Much of what we're doing as far as the legwork is centered around realigning our processes and policies, procedures. So for example, we have 28 different attendance policies that we need to get down to one. So if we continue to move forward with these, you know, fragmented, you know, processes or fragmented policies, we're never going to get to that accountable leadership that is so desired to make sure that we're effectively running a business. So on that journey, once we essentially unpack everything, align, the IT part should be pretty easy. So when you have all of those business processes and rules well defined, it's going to make for a much more simplistic and seamless implementation.
So I'm hearing that there's a lot of fragmentation across the organization, and prior to doing a large business system transformation, you're looking to standardize certain policies across the organization. I'm sure there's a lot of pushback, a lot of kind of territorial defensive postures that you may see from different departments. How politically do you navigate the imposition? Is it a top-down standardization? Is there a committee that everybody's kind of slowly coalescing together? How are you able to take an amalgam of different policies where probably many people want to stick with their own policy and they want the other departments to change?
Exactly. Right. That's a quandary I think that we're all contending with from time to time. But fortunately, we've had strong top-down leadership that sees the importance of doing this work. We have tapped into our key executive leaders, ranging from our physician enterprise. Our CHRO is our executive sponsor for the overall business transformation effort, which I think is a critical piece of getting all of the parties to work together and, making sure that, hey, we've got to come to some common terms. So there will be some degree of compromise. I think a huge part of this, Jordan, is going to be centered around change management, of which we're not underestimating. We're starting change management now, and we're still rounding out our phase 0 around our transformation efforts, which I think is a huge a critical piece that is going to position us for success going forward.
What is your timeline to, one, identify those new vendors, contract with them, standardize all your processes across the organization, and then fully implement and migrate to these new solutions?
Yep, we're on a 30-month timeline. So we're also accounting for some of that work, and we've been very transparent with the vendors. We've selected, as you mentioned, Workday and UKG, so they know that these transformation efforts and alignment efforts are underway. So they have been a significant piece of, what's our hard line in the sand to have this work done by. So I would expect the majority of this work to be done within the next 12 to 13 months. So we can make sure that it stays in line with meeting our target implementation of spring 2026.
So it's interesting that you have chosen to do this organizational-wide policy standardization effort on the heels of an Epic implementation. It sounds like you gave everyone a year and a half to kind of adjust to the new Epic workflows, and then we're going to go into a new initiative. I wonder if there were any lessons learned from the Epic implementation that you're able to apply and help streamline your business transformation efforts.
Absolutely. So that was one of the first things that we tapped into. Unfortunately, fortunately or unfortunately, I think it depends on how you phrase it. I lived and breathed the command center, so I got to see that front line. I was responsible for managing that. So seeing all of the different issues that were funneling in, whether that was in particular, role-based security, right? That's always, always, always one of the gotchas. So we are, in lockstep with our information security team to ensure that they are pulled in early on, so we can make sure that, role-based access and everything is tick and tied before we even get to go. And that's one piece. Epic has also afforded us with a number of different I would say communication pathways. So when you think about, or if anybody's gone through a go live with Epic, go live readiness assessments, and making sure that the entire leadership team, top down to, our managerial or even, team lead levels, has a full understanding and visibility into, the critical pieces that will be the success factor, right? So making sure that everybody knows what those risks are and what our mitigation tactics are, and we're applying that. We've done that in actually a couple of different implementations, ranging from construction to now our business system transformation that will be essentially a standard going forward.
Sounds like visibility and transparency into key metrics and definition for success and what the risks are was key to the success of your transformation.
Absolutely.
So we are approaching the end of this podcast episode. I'd like to ask if you would reflect on our topics of incorporating patient voice into IT development strategic initiatives, and also kind of the lessons learned from your business systems transformation use case going forward in the coming 2.5 years. You've mentioned about standardization, visibility, transparency. With patients, you said they're interested in having more in-person interaction, more flexibility in scheduling. Any kind of surprises or unexpected lessons learned that you think might benefit the listeners to the show right now?
Yeah, the one thing I would touch on is making sure that and like I mentioned, there's a lot of partnered leadership that has emerged. Whether that's dyad leadership with administration and physicians. I think that has bled over into project work where you have IT that's now taking that back seat versus being the person that's driving the effort. I think by default for many years IT has been pegged as who's going to lead an effort versus it being operationally driven. I am, I prefer to be a trusted advisor that's going to help inform and guide our operational partners. That's going to, ensure that they're successful, their teams are successful versus, me having, the glory and accolades for putting something in that, is not going to be well received. So, that's the one thing that I would share that's of increasing importance is making sure that you're that trusted advisor for your business partner. That's with respect to project management. So thinking about, you want me to touch on patient voice. I believe that it is a necessity to understand what your patients and the population that you serve, desire. I can tell you as a parent of a child that was a high risk cardiac kid. Having those key pieces of information at my fingertips to alleviate and allay some of the anxiety that I was, feeling as I was navigating an extremely complex healthcare journey. I take it very, personally and seriously to ensure that we're really looking at that and approaching it from a different lens outside of, what the organization desires to push out to, those that they serve.
I appreciate your insight, Sarah. I see a commonality to both of your responses about the lessons learned, which is essentially you put yourself in someone else's shoes, whether it be the operational business owners across the organization or in the patient's shoes as the parent of a patient, of a child with certain needs. So I appreciate the level of empathy that you offer and how that can drive IT strategy and vision. So thank you for joining us. For our listeners, this has been Sara Meinke of Baptist Health Jacksonville, the Senior Director in Enterprise IT Ambulatory Network Innovation. So thank you, Sara, so much for joining us today.
Thank you, Jordan.